Awesome. Well, thank you so much for having us here today to talk a little bit about the Watershed Navigation Center here in Missoula, Montana. And then just as we get started, we'll talk a lot more about the Watershed Navigation Center, but really it's a space that's near the jail to serve as a resource hub for individuals that are kind of transitioning out of incarceration, and also a space for our unhoused neighbors to come and get basic needs met, bathroom access, uh, navigation of resources, all those types of things. It does also have a clinic that is right next door, where medical needs can be taken care of as well. So just today to talk a little bit about who we are and what Watershed is and how it got started. Chaz will then talk a lot more about the operations, and all the partnerships that we have that make the Navigation Center work. We'll spend some time looking at lessons learned and success stories, and at the end, we'll share a little bit about the financials and the sustainability of the project and how that's all going to work, hopefully. And then, as just before we move on, I just wanted to call attention to this beautiful mural that we have in the Navigation Center that was designed and painted by two local artists, Aspen and Cameron Decker. The mural depicts kind of a Salish woman who's harvesting bitterroot so she's kind of at the center, and then she's surrounded by the bull trout and the teepees that are arranged in more of a circular pattern. And the design is meant to symbolize the tribe's seasonal cycle and to honor the encampments of the Salish people who have lived in the Missoula Valley since time immemorial. The Navigation Center is serves recognizes that the indigenous population is disproportionately represented among our unhoused and our incarcerated population. And so, for example, Native Americans only make up 2.8% of the Missoula County population. They account for almost 14.1% of our unhoused neighbors. And so we're in this space, we're thinking about that and tailoring services in that way and hoping to make the environment inviting. This is just a little bit about who we are with pictures from probably 10 years ago of us. We need updated photos. We work at Partnership Health Center in Missoula, Montana, and welcome you all to reach out to us anytime. We love collaboration. We love to hear about what others are doing. So thank you, Champs, for putting on this series for all of us to learn from each other. I'm sure, like many of you, we are a federally qualified health center. We serve roughly 18,004 patients in 2025. That's a hot off the presses number. We just did our UDS report, and we're very proud of that number because it coincides with a lot of changes at our organization over the past year, including an EHR transition as well as a separation from our county. So just a lot of administrative changes without a lot of disruptions to our patient population, which we are excited about. About 37% of our patient population has no insurance or is uninsured in 2025. About 21% was Medicaid, and we served 1,167 patients who identified as unhoused. That number is lower than it has been in past years, and we have a lot of ideas as to why that could be. Particularly some changes at the city county government level around criminalizing camping in town and making it just harder to find people, and people aren't accessing services quite as much. It's also could be a gap related to just some services that PHC provides that we'll talk a little bit more about later. We are co-located with the Family Medicine Residency of Western Montana. So we have about 12 physicians in training, resident physicians who work at PHC at any given time, and they are well integrated, I would say, with Chaz and his team, and they go out, which we feel really good about and excited about because they take what they learn and go out into their rural communities and underserved communities across Montana and the Mountain West. We have 15 sites across our service area, and that includes 8 school-based sites, which is our behavioral health only. So and those are in high schools as well as 5 elementary schools. And then we have one kind of dental only site that's co-located with the Missoula Food Bank. let's see here. So just kind of to give a sense of how we have ended up with the navigation center as one of the places where we provide services, it really has happened over a decade of time. I think in 2014, we opened the Pavarello Clinic that is co-located with Missoula's only homeless shelter once again. Um, and then I also pointed out the COVID pandemic, which we all know happened in 2020, but in Missoula, that really was kind of a watershed moment for how we took care of people in our community. Um, there was a lot of innovation and a lot of investment in improving how we deliver care to Missoulians who were unhoused. They opened the non-congregate shelter for people who had COVID or COVID symptoms at the same time that they decreased congregate shelter capacity. And then coming out of that in 2022, and with some of that funding, we were able to start the community care team, which operates out of the Navigation Center. And that team includes a nurse and a tenancy support specialist and goes out into or at that time included a nurse and a community tenancy support specialist that goes out into the community to meet people where they are at. That also coincided with the authorized camping site, which allowed about 100 Missoulians to camp legally on site within Missoula city limits, all in one place where they could access services. Unfortunately, that authorized campsite did close in 2023, but the community care team remains. And then in 2023, we were also able to open the Blue Heron Permanent Supportive Housing, which is adjacent to the Navigation Center. And then, as Chaz will talk more about, in 2024, the Watershed Navigation Center opened at the clinic side, and then in 2025 we opened the nav center, and that over the year was kind of a graduated opening in terms of we kind of tested out the waters, and then we're able to open more or less full time in 2025, late 2025. Just I think a couple things to highlight as in 2025 that happened was that has really kind of it don't propelled the success, I think, of the navigation center, but also complicated it sometimes as we closed the Johnson Street shelter, which was Missoula's other kind of lower barrier shelter. And then at the same time, the city implemented an urban camping ban. And so that has really made the need for Watershed a very high demand, I would say. And we've learned a lot kind of through those kind of external forces. And they've also really, and Chaz will talk a lot more about this, informed a lot of the partnerships that we have. So for example, municipal court comes to Watershed and does Muni Court once a month to help people kind of quash some of those citations related to urban camping. And that's just one example of kind of the types of partnerships that we have. Ooh. And this is Watershed right here, this blue building. It was part of the Trinity Housing Development Project that included kind of 30 permanent supportive housing units and also has over 200 income restricted apartments. You see those apartments back here in the yellow. This really was a city and county government led initiative to address an issue of jail overcrowding. So there was a report about 8 to 10 years ago that said if we don't do something now, the jail will have to grow. And so this is one of those solutions, which was very forward thinking, I think, of our local government. The Navigation Center also provides quite a bit of support for the permanent supportive housing residents who live next door. There's a separate entrance in a separate building, but there's often a lot of crossover between the two populations of people accessing services, especially in the medical clinic that is there as well. I'm gonna go ahead and hand it over to Chaz, but Chaz had this quote in there, and I think it kind of perfectly highlights kind of what happens at the Navigation Center. Chaz and his team do an amazing job kind of welcoming everyone into the space and also making sure that everyone feels respected, I think, at very different times and in different ways by having pretty clear expectations for behavior and addressing that when anyone is not being super disrespectful. Chaz, I'll let you go.
Awesome. Thanks so much, Becca. Great job. Can you run the slide still? Perfect. So yeah, here is just a short list of some of the stuff we do. I mean, partnership or Watershed really is a safe, welcoming, judgment-free space for people to be without buying. I'll call it an escape from capitalism. And at the very baseline, I think that's probably our most valuable service is giving someone who's unsheltered a place to feel without that judgment, without that just feeling of I don't fit in, right? Like you can use your $1.50 and buy a drip cup of coffee somewhere and go sit in a coffee shop and stay warm, but everyone's staring at you. You might stink a little bit because you haven't had a shower. This unsheltered population knows that. They might try to act like they don't, but they know that. And so really just giving that baseline spot for someone to come after a long night of being shuffled around Missoula, because that's the current ordinance is that people aren't allowed to be camping or sleeping anywhere, to just come and sit and take a nap. We have nap time in the morning quite a bit, but we also offer laundry, lockers, Wi-Fi, computers, document storage, mail services, clothing when we have it. We do cups of noodles, and then hot cocoa is a big hit in the wintertime, and then hygiene kits. Eventually, we will get some showers going, but it's tough because we only have two bathrooms, and about 70 people a day came through yesterday. And so if you think about whittling that two bathroom supply down to one while someone else showers, that's a lot of people for one bathroom. So we're navigating that. I think we're going to do dedicated mornings for it, but we'll get there. We can do next slide, Becca. Perfect. So yeah, on site, we have tenancy support services. So we've got three tenancy support specialists, and they do exactly that. They support people with their tenancy. One of the key things I think that we're doing with folks is really allowing our tenancy support specialists to work with people through the entire continuum of housing, from all the way in sheltered, sleeping in a tent, to maybe temporarily housed at the safe outdoor space, into permanent housing after that. One of our tenancy support specialists that we actually hired when we created the community care team long ago is still working, and he's got people he housed 3 years ago that he still does tenancy retention with. And that really shows. And he's got people, he's housed someone three different times. But because he was there to support them through that process, they never lost their voucher and they never had a formal eviction. He was able to sit there and mediate and advocate for this person to be asked to leave rather than a formal sheriff eviction that goes on his record forever. And then we found housing in other spots for him. So that's kind of how we look at that tenancy support piece. At the Navigation Center, a key element of that is the documents and storage of the documents for folks, as you all probably already know. Losing your ID, birth certificate, and everything else when you got swept or picked up for a charge isn't really conducive to moving through long processes of housing. So we're able to store that stuff for folks, and our tenancy support specialists really have that on hand. And then again, you work your butt off, you find some funding, you get someone that $50 birth certificate and $30 ID instead of just handing it to them and crossing your fingers and hoping that they're going to hold on to it. We'll make sure that it's there for them when we need it. And so one of the things we'll do that I really like as well is we've got a intake packet that we can share with you folks as well. It's Missoula Housing Authority is the organization that manages most of our low income subsidized housing opportunities. So they have a checklist that they put together. So we, on the front of the packet, we have the checklist that says these are all everything you need to apply for these apartments. And then we get all of that stuff and we scan it into emails and we'll email it to the people who have the emails or we'll hold on to it. And then every week, the Missoula Housing Authority comes out with a list of vacancies at all of their properties. And so if we see a vacancy at the Villaggio for a one bedroom that fits this person, we'll email that packet to that landlord and it'll come right into their inbox right then and there. So we're able to really engage on a weekly basis with according to what the supply is, right? So if we know that there's an opening somewhere, we're going to send everyone's packet we can into that open slot and hope that one of our folks gets it. We also work with a lot of other community partners so we can try to stay ahead of some of the goings on. I just found out that uh, building downtown is being condemned that had previously housed a pretty vulnerable population of elderly folks, 40 units ranging in rent from $300 to $600. So now we know through our coordinated entry system case conferencing that that's coming down the pipeline. And I might need to look at some new grab bars for the bathroom because we're going to have a bunch of new elderly people coming to the navigation center looking for supports. And that's going to just be a mess. I mean, that kind of affordability just isn't realistic in Missoula anymore. So we don't know what we're going to do, but at least we know about it ahead of time because we do that case conferencing on a weekly basis to talk about what we're learning from different community partners and what we can kind of expect coming down the pipeline. Um, and then my one fine day, I want all of the landlords to love our tenancy support specialists so much that they're just willing to rent to us immediately. And so that landlord relationship is a key piece to all of this. So as we continue to get people housed, I really expect our tenancy support specialists to follow up, do check-ins. Even if there's not anything going on, send that landlord an email and say, hey, how is Janet doing over in unit 303? I'm just checking in on her. Really empowering those landlords to feel like they aren't just renting to a previously homeless person, they're renting to a previously homeless person with really high level tenancy support on their side. So it takes away some of that fear for the landlord community to be able to say, like, yeah, this is kind of scary. This person doesn't have the best rental history, but I want to help. I just don't want to feel like I'm taking on a huge liability. Having our tenancy support specialists follow up and make those follow-up appointments and stuff is really important and really empowers those landlords to feel more comfortable renting in the future. We can do the next slide, Becca. So yeah, the medical piece of this. Um, We knew, so I'll backtrack a little bit, but we used to do a super utilizer program, a home visiting model. And then when COVID hit, we decided home visiting was going to go on the shelf, but I still needed a job. So I decided we would go down to some homeless camps under the bridges and places and try to access that unsheltered population who we knew wasn't coming into the clinic and was accessing services all weird. And so I brought a resident doctor down with me. And sure enough, there was open wounds and trench foot, and everyone lost their medications. And we saw really quickly how big of a need it was to really provide a different level of access to this unsheltered population. And we've carried that through. Post-COVID, we really decided that that community care team was going to be a piece of our strategy to make sure that our marginalized populations within Missoula have equitable access to our high-level healthcare opportunities. So yeah, patients at the navigation center can be seen this afternoon. They're coming in at 1 o'clock. We've got a guy who got picked up for disorderly conduct, and the cops didn't let him take his bag with him. So he left his bag full of medications behind. Got out of jail this morning, showed up, said, I need all my meds. Instead of calling and trying to schedule out a future opportunity to get those meds, we're going to have them walk in and be good to go. Um, Continued wound care is another one. We've got some really long lasting wounds out there. It's not as simple as like, here's your Band-Aid, keep it clean. A lot of these wounds can really take a long time to heal. And we only have one wound care clinic in Missoula, and they have fired people. I mean, it takes a lot to get there, but unfortunately, this population, sometimes with substance use disorder and mental health illness, aren't always, I don't want to say acceptable, but they don't always fit in well at a normal clinic. And after a few different instances, they'll be told they have to leave and they're not welcome back. They've got the big angry red alert in their chart. And so our providers do their best to make sure that wound care is happening. I am happy to say we are doing wound care showers. So we do allow showers for folks who are medically deemed good to go and they can shower and this is what they need. And that's been a huge help for some people with some wounds and some tough to reach spots that need deeper cleaning than is available. And then to be able to go back to the clinic and get their wound redressed, that has been a wildly successful kind of process for us. Is come to the navigation center, take the doctor will take your dressings off, check it out, you'll go shower, clean up, and then the doctor will redress your wound. Has worked really well for us. Um, Recently, we've started doing some state hospital discharges. Prior to us getting involved, the discharge plan was literally the Poverello parking lot. So our homeless parking lot, which is rough living, as most homeless parking lot, like homeless shelter parking lots are. There's lots of open use happening, and people getting out of the state hospital, believe it or not, didn't always just go right into the clinic we have at the Poverello Center. We'd often lose them between getting dropped off in the parking lot and their scheduled appointment with our providers. So rather than getting dropped off in that parking lot, they get dropped off at the navigation center where we can get them, an easy mac and cheese and a hot cup of coffee and a space for them to store their stuff. And they're coming in and they're seeing people, and then they can see the provider. They can get their meds refilled for a longer amount of time. They can start the process of establishing care. And then the similar situation with the jail transitions. You get discharged from jail and you're told to follow up and do X, Y, and Z, and it rarely happens, as we know. Having the navigation center and our clinic literally a stone's throw away from the jail. Like I could throw a stone into our jail basketball court area from the front door of the navigation center has really improved that follow up and that transition. Um, and really, for the folks coming out of jail, it's one of the few times that we might get to work with them while they're sober and on meds. And so it's a really important piece. And that's the same thing with the state hospital. It's really frustrating for the community care team to know someone's on a long-lasting antipsychotic shot leaving the state hospital, and then they miss it once. And it's been 3 weeks, and now we have to orally titrate back up to a tolerable level to where we can get you back on that shot. Like you lose so much ground when you meet someone 3 months after being discharged from the hospital who haven't had their shot. Similar with jail. When you lose someone to that Poverello parking lot or the liquor store or whatever it is, they might not stop drinking or using again until they're back in jail. And trying to work with them when they're in those like acute states of use and mental health crises is extremely challenging. So really being able to be there during that window of change and really encourage folks to access our services has been a huge piece to this. Um, we also don't allow open use at the navigation center. This is getting a little into operations, but it's all behavior based. You could be totally sober and be terrible to be around. And as long as you can be a part of a safe and calm environment and be respectful towards others and clean up after yourself, you are welcome at the navigation center, no matter how sober or drunk or high or whatever it is you are. If you can do those things, you're welcome to be there and be comfortable. Um, some of the roles at the watershed. So we've got the front desk, is really, we call it the hot seat, because that's the person who meets everyone, does a quick intake of demographics, and then takes all the requests. Like, I need this, I need that, I need this thing, I need that. And then we have someone in the community room. I kind of call them the conversation lifeguards. So we don't have someone patrolling, making sure everything's okay. It really is someone just kind of hanging out, working on their computer, available to chat if necessary. And then we have some counseling offices in the back area if someone does really want to have a deeper conversation and talk a little bit more in detail about some private stuff. We can offer that space as well. So we've kind of got those three levels of access for folks where it's the front desk, I need a cup of noodles. Here you go. It's the community room. I saw you guys have this MHA, Missoula Housing Authority packet. What's this all about? Well, let's look it over. And then office and admin time if we really need a quiet, calm space to have a deeper conversation about stuff. So yeah, day at the Watershed Navigation Center. It's always kind of different, believe it or not. So yeah, 7:30 we show up, stock the front desk area, get everything ready, get the coffee going, everything like that. Fill up the water jug, you get the TV up and running, turn the heater on, all of those fun little things. And then we do a daily huddle every day with our the clinic people, and it's really, really beneficial. So I have access to all of our electronic medical records, and I have an additional EMR that tells me who's been in the hospital and ER the previous night. So every morning I'll get up early and I'll hop on and I'll see who is in jail, who is in the ER, and who is in the hospital the night before. And that'll give me the chance to let the provider know, hey, Brandy swallowed some push pins last Friday and is getting released from the hospital today, and she's going to need some follow up. That lets the provider know, like, hey, Brandy's going to show up. She's going to need this. This is her history. So we can kind of plan the day out that way. I can sort of hotspot some potential clients of shared concern, that sort of thing. And then, daily insights and anticipated challenges. This is another one to where during those coordinated entry system meetings, we will find out like, hey, the cops are doing sweeps at the Poverello parking lot. There's going to be a lot of really tired people coming in today. So there's going to be some extra grumpiness. People are going to be extra tired. And they're going to be, let's be a little more calm and gentle with them than we might be otherwise. Um, And then safety issues to watch for. So yeah, cold. If it's extra cold out, we know that there might be some frostbite coming in. If it's extra wet, we'll get ready for some trench foot, that sort of things. And then we'll do a calm metric for the day prior to just sort of see how everyone was doing the day prior on a scale of 1 to 5, and we track that. If it's a 5 or it's 4 or 5, we'll ask like what happened that made it so stressful. If it's a 1 or 2, we'll say, hey, what happened that made it so easy? And we'll try to track how that works and really try to reproduce those easier days. Um, 8 o'clock, the front doors open. And then I'd say normally probably between 5 and 15 people are waiting outside. And we have a wonderful relationship with both our jail and housing authority who owns that property. They allow people to hang out there at night. So long as they're being respectful and things like that, they will not go shooing people around that area. And it's really wonderful. 8 to noon, people come and yeah, just do what they would normally do at a navigation center. Meet any of their needs we possibly can. We'll close for 1 hour during lunch every day. That's just to give staff a chance to take a break. We can restock everything. And people who might be sleeping, it's a chance for us to wake them up and say like, hey, do you got anything going on this afternoon? Otherwise, it could just turn into a space for the same 50-ish people, 40, 50 people to stay from 8 a.m. till 5 p.m. And while that's nice to do, we really want to make sure that everyone has equitable access to it. So we never turn anyone away or kick anyone out, but a lot of the times people will come and sleep from that 8 to noon spot, and then at 1 o'clock or at noon, head out for their day and go do other things throughout the community and give other folks an opportunity to come in and take some couch time. We're starting movie days, so we've got afternoon movies happening. People love that. It's been a real big hit. We'll get the popcorn going, movie happening, and quiet time naturally happens. The organic regulation of behavior in that space on a peer-to-peer level is really incredible stuff. And the amount of patience that these people have with each other, it's really, really beautiful to watch. People know if Brandy's having a really hard day, she might scream a little bit. And while it might be triggering for you, please don't yell at her because it only makes it harder. The staff will be there to take care of that stuff. We also normally have our community partners come in the afternoon. Um, and then, yeah, around 4:30, we will give people the 30-minute warning, and 5 o'clock, we'll close the doors and clean up. So yeah, we also have the Community Justice Department has folks there on site, which is hugely beneficial. I've been doing this for a year with the Community Justice Department Reentry Navigator at our site, and I still don't fully understand our court system, or why they do some of the things they do, or which court are you in? Is this district court? Is it community court? Is it municipal court? Is it family court? Is it drug court? Is it jail? Like what kind of court are we talking about? They've got that all figured out. And when we start talking about, people in a medical terms working to the highest level of your licensure, it's a huge support for my tenancy support specialist to be able to focus on housing because they know that the reentry navigator has that Department of Corrections piece figured out. Um, and it's been wildly beneficial for them to have us as well. A lot of those, we're finally figuring out what a judge means when they want a mental health eval. And it turns out it isn't a full 4 hour NP psych provider talking. It can be just a, hey, do you have regular depression? Do you need to be on medications? Like those sorts of things. And so we're really working with the court system to make sure that what the judges are asking for is being met. We do quite a few chemical dependency evaluations at the NAV Center, both with our behavioral health department, but then we also have an outside independent guy at LAC who only does CDEs in the community, and he'll come and meet folks there for special occasions as well. And having that ability to really be there for someone who wants to go to rehab when you catch them sober out of jail and they're like, I need to go to rehab, I need to get inpatient. Well, we can call Paul and Paul can be here this afternoon and get that CDE done. And then we'll fax that over and we'll really try to make this happen as fast as possible. Every other week, they have the municipal Zoom court where guests can see their judge through a computer at the navigation center. So really keeping those, it's called failure to appear. It's always really frustrating when I check the jail roster and I see people in jail for failure to appear and then resisting arrest and then obstructing justice all at once. And it's one of those terrible cycles where they don't get along well with the police. So they don't want to engage with the system. So they avoid the system. Then the police find them. Then they get in an argument with the police. They don't want to give their ID up. That's resisting arrest and obstructing. housing, and it just adds all these layers and layers of problems for folks. So being able to make sure that at least that failure to appear doesn't show up, and then the cops don't have a real reason to pull you over because you don't have a warrant out, and it avoids that entire rigmarole and terrible cycle. The last Friday of the month, we have a big party. The community court is what it's called. And we invite other community partners. We have a partnership with the local School of Beauty, sends their folks over to give unsheltered folks homeless or haircuts before their court appearance. We'll invite all of the mental health centers, have some sort of representation that comes. Some case managers will show up and look for their folks and try to catch them at that point. We're partnered with a local deli who provides free sandwiches and all sorts of awesome little goodies. That's kind of a special treat for folks. And yeah, it's just sort of like a mini resource access day, is the way I kind of look at it. So again, thinking about everyone working to the highest level of their licensure, I really wanted to create a space where everyone's able to do exactly what they're specialized in. So we have Veterans Incorporated comes on Friday mornings, and they have access to that darn DD 214. If you're an unsheltered person in Missoula and you really are a veteran and and you can get your DD 214 from this system, you should be housed within a week or two, at least in a temporary housing spot. So it's really valuable for people who come in and say, I'm a veteran, but working with the VA is really hard to get my DD 214. It's going to take a long time to get mailed, all of that sort of stuff. We have that access right then and there. And then they also are specialized in a lot of that veteran service stuff that's special for veterans that we don't get to do a lot of because they kind of get their own case management team. They get their own service sort of umbrella. Once they are identified as an actual veteran with the DD 214, all sorts of doors open up for them. And that Veterans and Corp is really able to get that done. Job services comes, and that's been another huge help for folks. I had no idea. And again, this is why we invite these people. It's something called a letter of explanation. So if you think about a lot of our unsheltered community has a criminal background, and jobs require a criminal background check. And so rather than waiting for that background check to come in and have to explain yourself, the job service people sit down and help write a letter of explanation that says exactly like, hey, I submitted for my background check. Here is what happened before you get my rap sheet and start making judgments on me. This is why this happened. This is what I've done to change that behavior. And this is why you don't have to worry about it. That piece has helped a couple of people with some pretty crazy records get jobs. And so they've really been able to help people with that. Unfortunately, yeah, it's a tough one to have to go through that, but they do a great job placing people, and then they are also able to connect people with kind of day labor jobs. And there's a spot in town called People Ready that will pay you within 2 days of your shift, and so you can get like temp jobs and stuff. They'll hook people up with that kind of thing. We have a completely unsheltered guy with zero income who's court ordered to take 2 UAs a week at $50 a week and pay for his supervision at $150 a month. And if he doesn't do that, he's out of compliance with his probation and goes back to jail. And so he met with job services, and job services hooked him up with that People Ready. And now he goes every day and gets paid and will hopefully have a full-time job with one of the services that he's been working with when it comes up. So that was a really great to have them there for that guy at that point. The Housing Advocacy Network through the Missoula Interfaith Collaborative is another key partner. So believe it or not, our tenancy support specialist caseloads are almost always full. And part of that reason is because we really do expect them to follow their patients or their clients, guests, whatever, into that housing opportunity. So just because they got someone housed doesn't mean they're off their caseload and we're on to the next one. So that Housing Advocacy Network can do a lot of the I want to say little because it's important, but a lot of the more basic housing tenancy support. So as simple as going through and coming up with a budget and then finding apartments on Craigslist that fit that budget. If the Housing Advocacy Network can get that done, we can apply for what's called the Housing Solution Fund because we're a certified Housing Solution Fund site navigator kind of spot. So the Housing Advocacy Network finds someone with a budget and they have an apartment, but they can't afford the first month's rent and down payment, and they owe $500 to Northwest Energy. So that's a barrier to them getting in there. We can apply for the Housing Solution Fund to pay for the first month's rent, security deposit, and that back pay to the energy company. We've also got SNAP services there. Unfortunately, there's requirements to prove how much you need SNAP. and you have to volunteer or work up to 24 hours a week or be in school or be as part of a special population. SNAP benefits got a lot harder to manage than just I make less than X amount of dollars. And so being able to have those SNAP services on site to be able to support people to continue to access even just 100 and some dollars a month in SNAP benefits for an unsheltered person can mean the world. It gives them just a sense of normalcy to be able to go to the grocery store and buy a little something, even if they don't have a fridge to put it in. So that's a really important piece of this puzzle as well. And then we also have our aware and packed team that comes. They are our higher level sort of mental health services. I think packed teams are pretty nationally recognized at this point. But they're able to come and meet with their clients Friday mornings at the NAV Center. And a key thing for this is part of the packed requirement to be on their caseload and to access all of those awesome services, you have to engage. They have to be able to check a box and say they talk to you at least once a week. And that's not always easy to do when the police are chasing you around town and there's no day shelter to go to and you don't have enough for a cup of coffee and you're trespassed from the mall and packed and you have no phone. Well, packed is able to meet folks and keep them on their caseload by checking that box and saying we checked in with them, we got them their meds, we're able to work with them next week too. You can go to the next one, Becca. The mobile support team is an awesome team here in Missoula. I kind of compare the mobile support team is like the emergency room outreach, and the community care team is like the primary care outreach. So the mobile support team is a partnership between us and the fire department, EMS, police. They really respond to mental health crises throughout the community instead of the police showing up in their, vests with guns drawn. We're able to send out a counselor and an EMT to go check that situation out, and then they'll often transition them over to the navigation center if they're an appropriate fit. We don't have a crisis receiving center in town. We have the ER and the navigation center and the jail. Like those are kind of the three options for our unsheltered folks to go. And so it's really important for us to have that mobile support team to be able to respond and get people who are escalated in a calmer state so they can continue to access services and not overburden the jail or the ER. We work closely with the Poverello Center as well. It's our only remaining shelter, and they do the best they can, but you can really only do so much when they are rightfully prioritizing housing and feeding as many people as they can every single day. And that often comes at the cost of being able to be extremely patient and, have a lot of tools for folks. Unfortunately, if you show bad behavior at the Poverello, the only tools the front desk staff have are calling the cops. And the cops have gotten so sick of it that they have created a protocol to where you're automatically trespassed for up to 30 days from the POV if the cops are called on you. And so people lose that access really quickly to the Poverello Center. And so being able to provide a space during the day for folks to go, where we have more tools than just 911. All of our tenancy support specialists, all of the front desk staff, all have training in all sorts of de-escalation skills, all of that good stuff. So we're really able to provide a space for people who might struggle with their mental health and substance use to not be trespassed or find themselves in a situation they can't handle. Between the front desk and the conversation lifeguard, we really are able to get people kind of calm down without having to take that next step. Um, yeah, so a couple successes. There's a picture of the community court and the navigation center. You can see it's not very big. Of course, like right away, we found out we needed more space, but we're doing the best we can with what we can. There are days where there are people literally in pallets across the floor and on every couch because there just isn't space, but it's warm and comforting and they know they can be there. Um, yeah, so perfect. Becca, thank you. We had a gal was released from the state prison after being arrested when she was 19. She spent 20 years in prison and she just got out, had never had her own apartment, didn't know what she was supposed to do next, had a parole officer who was really supportive and really wanted her to get access, but that parole officer isn't always great at getting people housed. Um, there's a spot in town called the Safe Outdoor Space that helps people with a tiny home, a 10 by 10 foot little tiny home. She had been in there, but they had really they require a lot for folks. It's a very high barrier service where you have to do UAs in the morning, you have chores to do, you have to commit X amount of your income to go to a savings account. It's quite a bit. And Tanya felt like that was a little bit like jail, and she wanted to be done with jail, darn it. So she didn't fit in there and wasn't able to get there, but she was able to regularly come to Watershed in a way where she was able to clean herself up, do her laundry, and then she started working those day labor jobs I'd mentioned earlier with the people ready stuff. And she was able to do that long enough to turn that into a full-time job somewhere. Then she starts building her resume, and all of a sudden now she's got a full-time job as a baker in a bakery that she lives above and pays for her on her own. And she still comes to the navigation center every now and then and whips people into shape and gets them on the bus. We got to get on the number 14 bus. It'll take us to People Ready. We'll get you a job today. You can get going. So having Tanya come back and do that kind of stuff is really great. Yeah, the state hospital discharge again. That window is just so darn important. And so being able to have people get dropped off, she changed into her own clothes for the first time in I think she said 4 months. Um, and went out and got herself a phone card and some nachos. And she could not stop talking about those nachos. It was the highlight of her day. Because she had a safe space for her to store her stuff, she was able to come back. She had two giant duffel bags, like 60 pounds each. She was able to store those at the navigation center and safely go and, access all of this different stuff. She came back to establish with her high level PACT team, and then even had her SDMI, severe debilitating mental illness waiver from a third party. They had that interview at the navigation center as well. So she was really able to just knock it out, knock it out, knock it out. And then the PACT team has services to what's called Goal 189 funds, which are funds to keep people out of the state hospital. And they were able to get her a 30-day hotel. She's still in that hotel. They got another 30-day extension while she works on stabilizing and finding a job and getting through all of that sort of stuff. So we were able to really provide that safety net for this person to not end up in that trap of the Poverello parking lot, which is really, really awesome stuff. A lot of people in the community are really excited about this piece. So yeah, we see about 50 to 70 unique individuals a day. The laundry is going from 8 until 5 and sometimes after 5 every day. That's just a really important piece, especially in the winter, fall, winter, and spring months when it's wet. Being able to get stuff dry. You got a bag full of wet stuff. It's only so long until it turns moldy. So at least being able to use the dryer and get that stuff dry is a huge help for folks. The 24 lockers we have, really, we only turn those over when people are either going to jail for a long time or get housed. And we realized pretty quickly too, those have been full since week one, really. Um, I'm not kidding when I say thousands and thousands of cups of noodles and coffee have been handed out. And that's another one of those. We can always say we'll at least be able to get you a cup of noodles. And then the endless amount of patience, respect, and rapport building is probably the most important piece. We had a guy, I think it took him 6 months until he asked us for a phone. And then once we worked on getting him a phone, he started talking to us about housing, and now he's on every wait list and he's an elderly guy, so he's really crawling up the wait list and is going to be getting housed pretty soon, I think. I'm pretty confident in that. But it was those 6 months of just letting him come and show up. Big K, his name. Big K just goes, sets up in the corner. He's a microwave master, brings his own food and uses that microwave to make all sorts of crazy chef concoctions. And he did that forever until he was really comfortable to come talk to us. And now that he is, he knows it's a space he can be and that he's really, really ready to take those next steps. Um, and I think that's the missing piece to a lot of this. There's a lot of help out there. There's a lot of folks offering to, do a housing application with you. But what does that really look like? Is that person you trust? Do you really want to show up the next day to follow up and check on where you're at in that list? We're able to get that done because people want to come back and work with us at the Navigation Center. So yeah, some of the challenges we've had, like I said, we don't have a crisis receiving center anymore. It closed like literally the month we opened. And so a lot of places in town and a lot of service providers just assume that we're able to take that on. While we do manage crises, right? While our staff is very highly trained in that kind of stuff, that's not our number one job. And it's really, really hard. It just happened this morning, as a matter of fact. The sort of cascading PTSD triggers where someone's having a rough morning and just screamed, and then that made Mike really mad. So Mike started yelling at her, and then someone with a history of domestic violence got really triggered by that because Mike was yelling at a female who's mentally unwell, and they're at the front desk crying, and it's just this whole explosion of feelings happen. And so for us to be able to really manage that quickly and de-escalate people, it's huge. But if we're just doing that all day long, it doesn't give people that opportunity to really relax, and to really feel like they're in a calm and safe space. So we really have to mitigate, and we work closely with police, ERs, all of the places people in crises might end up. We work closely with them to make sure that when it's appropriate, they are brought to the navigation center, but when it's not, they really aren't brought there. The other one, we don't have a detox center in Missoula, and the ERs won't do it. So that's one where We might be able to talk PCP into coming up with a medication cocktail to help people detox on their own, but that can still be pretty dangerous. So getting people into rehab and that detox step is always a sticking point for us. Really, really rough. Our shelter is currently at a lottery system. So a lot of people end up sleeping outside. So you literally put your name on the list. And we're able to do that from the navigation center. So we can call between 11 and 3 is when you have to put your name on the lottery list. We can call and get many people sort of on that list so they have a chance to stay inside that night. But when they don't, they show up the next morning in just really rough shape. Um, and then, yeah, there's so many places to document all the wonderful work we do. Our social workers at the main clinic need to know what happened. People in Billings, Montana need to know what happens in Missoula, Montana. So we have a statewide HIMIS record that we do. We've got our own grant reporting to do. It's just a lot of documentation and a lot of that to figure out, but we're doing it. And we've got intake forms and things like that that really hit the crux of a lot of stuff. And we're working our way through how to do that in Epic and our EMR. You can go to the next slide, Becca. And this is all you. This is why you get paid the big bucks.
Yeah. I think just to touch a bit on budget, because I think it's important to know kind of what this type of stuff costs. And it's right now we have a roughly $400,000 budget to water just the NAV center side of things annually. And we're fortunate in that we have healthcare for the homeless dollars. We also have funding support from the city and the county. And thinking about that picture, like as some of that city county support might sunset in the next 3 years. We're looking to tenancy support billing, which is now reimbursable in Montana, but we haven't had a ton of. We're still feeling that out. For the $17.01 per 15-minute increment of working with someone, and then obviously some medical and behavioral health billing as part of that as well. But I think as far as budget goes, we do have a pretty hefty amount right now for supplies, given all those cups of noodles and other things that we purchased for the center. So yeah, the rest is pretty much FTEs. And with that, I think we're moving on to questions. If there are any. Thank you.
Yeah, thank you, Becca and Taz. That was really great information. I loved all the patient stories you shared and community partnerships you guys have. Um, One question that I had real quick was, so you guys said you've been operating for about a year, and maybe kind of where are you looking to grow in the next few years? And now that you've been up and running for a bit, like what are you have some ideas to help expand or yeah, just improve the services you guys have?
You want to touch on that, Chaz?
Yeah, I mean, I think as we continue to add more community partners to the space, it lowers our burden to have a bunch of FTEs that we have to worry about paying for every year. So really continue to expand continue to expand our partnerships within the community so we can really free up our employees to do exactly what they should be doing. So we don't feel like we have to constantly be hiring more and more and more to meet a growing demand is definitely one of our goals.
Great. Thank you. And then, yeah, Jen, put down in the chat if you guys have any questions. Feel free to come off mute or you can add them down in the chat. Um, and yeah, I'll see if, great. Thanks, Liz. That was really valuable information. And thank you guys so much again for sharing today. Yeah, I wanted to thank everyone for attending today. Hopefully this training has helped bring you some new skills and tools to your job. And as always, we really appreciate your opinions about today's event. So we'd love if you guys took a brief moment to complete the evaluation survey that's linked down in the chat. There's a chance to, give some feedback and then also suggest some topics that you'd like to see covered in this collaborative for when we do it in the future. So we'd love to hear your ideas. And I wanted to thank Chaz and Rebecca again for your guys' presentation, and thank you all for attending and listening to the session today.
Thanks, guys. Appreciate it. Please reach out anytime.
Yes.
We are always happy to share and chat. I'm going to go up to a reservation in Browning, Montana, outside of Glacier. Their health center's opening up a homeless shelter, and I'm excited to go work with them and work with them on what that looks like. So yeah, always happy to chat and whatever you need, let us know.
Great. Thank you so much. All right,
Thank
everyone.
you.
Take care.
Bye-bye.
Thank you.